Hold on, say that again.
I washed my hands. Okay. Hi Brittany, how are you doing today?
Good.
My name's Abby, I'm being a physical therapist.
Hi.
And I have a referral from the doctor about your right total knee replacement, is that correct?
Mm-hmm.
Okay, I have a referral to take you down to the physical therapy department and work on some stuff today. And so before we do that, I'm gonna check your vitals, like your blood pressure, your pulse, some of your sensation, how your joints are moving and everything, and some strength. So is that okay with you?
Mm-hmm.
So could you repeat a little bit of what I said?
We're going to check my strength, some sensation, and some joint motions.
Okay.
And then go to physical.
Yeah, and I'll explain everything a little bit more as we go on and more in depth. So do I have your permission to proceed?
Yes.
Okay. All right, so first what I'm going to do is take your blood pressure. And have you had any surgeries, mastectomies, breast cancer, anything indicating that you can't have your blood pressure taken on this
No.
side? All right. Okay, so go ahead and have your arm out like that. Hold that up in for a minute. It's a good size. Alright, then you can just relax your arm and palpate that artery. Okay. Alright, I got about 116 over 77. Is that about normal for you? Okay. Take this off. Now I'm going to take your heart rate. Okay, I got about 71 beats per minute. Is that about normal for your heart rate?
Mm-hmm.
Okay, and before we start anything, do you, if you could rate your pain from 0 being no pain at all to 10 being the worst pain imaginable, what would you say you're experiencing?
Probably about a 6.
Okay. And then at your home, do you have anyone living with you that can help you out whenever you get discharged?
Yeah.
Okay. Okay, good. And do you have any stairs that you're going to have to...
Mm-hmm.
Okay, good. Alright, so first what I'm going to do is check the mobility of your leg over here, the unaffected side. So I'm just going to lift this up. Okay, so wrap that around. And then, so I'm just going to kind of just bring your knee towards your chest. And then bring that down, bend your knee, go in, out, down, out. Okay, and then I'm going to do, you can extended. And then go ahead and point your toes up for me. Good. And do your great toe. Try to push against me. Okay, good. So everything looks good over here. And then now I'm going to check this other side, and I know it's kind of painful, so I'm going to be very easy about it. We're not going to look at that knee yet, but we're just going to kind of check and see how your hip is moving over here. So I'm going to help you, and you just kind of try to lift your leg up a little bit. Does that feel okay?
Mm-hmm.
Okay, and then bring that slowly back down. We're going to go out. Check the ankle. Good, got some good mobility there. Your toe. Can blink that up and down. Okay, good. Alright. And then next I'm going to do take some measurements on your knees. We don't really want to move that around yet too much. And so what I'm going to have you do is try to flex that knee as much as you can. Bend that knee, there you go, until it hurts. Is that about as far as you can go?
Yeah.
Okay. Okay, we're about 39 there. Alright, and then I'm just going to try to push it up a little more, and you tell me until it hurts too much.
Right there.
Okay. Okay, and there we made it to about 46. Okay, so now what I'm going to have you do is try to lower that knee all the way straight as much as you can. About right there? Okay. Okay, we're at about 26. And then now I'm going to try to push it just a little bit, and you tell me if it hurts too much.
Okay. Right there.
Okay. Okay, and we made it down to about 23. Okay, looks good. Now, what I'm going to do is kind of test your sensation. And I'm just going to lift this straight up a little bit, wrap around my legs. Okay, and so I have a cotton ball here, and what I'm going to do is I'm going to touch your leg like this, and every time I do, just tell me yes if you can feel it. Okay, let's go ahead and close your eyes. All right.
Yes. 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 Yes.
Good. Now I'm going to do it on the other leg. So you can keep your eyes closed.
Okay. Yes. 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 Yes.
Okay, good. Alright, so now what I'm going to do is I'm going to compare both legs. And so I'm going to just ask you, does this feel the same as this? And you tell me if it feels the same or if it feels different.
Okay.
Okay? So does this feel the same as this?
Yes.
This is this?
I felt it on the left.
Okay. This is this?
I only felt it on the left.
Okay. This is this?
Feels the same.
This is this?
Same. 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 Same.
Okay, good. Now we're going to move on to some joint proprioception. So what I'm going to do is I'm here, and I'm going to hold your foot like this, and we're going to move up, in, out, and down. And each time I do, I want you to tell me when we stop where the movement's at, okay?
Okay.
So go ahead and close your eyes. Alright.
Up,
this side. Alright, here we go.
Up. Down. In. Out. Up.
Good. Okay, and so now you can watch what I'm doing. What we're gonna do is I'm gonna hold your ankle over here the same way, and when I move like this, we're gonna do up, out, in, and down again. And on this side, you're just gonna do the same exact thing. So mirror what I'm doing, okay?
Okay.
So go ahead and close your eyes. All right. Good, good job. Okay. So now, when you back up, I'm gonna go ahead and put your shoes on. So we're gonna get ready to transfer over to the wheelchair. Be easy with that legs. I know it's hurting. Little tiny shoes. Side on that one.
Sometimes I just wear them like that anyways.
Okay. You wear them like slippers sometimes?
Yeah.
Okay, yeah, they push down enough. That'll be enough traction so you won't slip and fall.
Yeah.
Alright, and so how we're going to do this is I am going to have you go up on your elbows and you're going to kind of scoot that way. And while you're doing that, I'm going to help your leg over to the side and we're just going to go up in the sitting position, okay? So on my count of 3. 1, 2, 3. Leg scoot. Put that leg down and slowly lower this, scoot to the edge. Good. Okay. Put this robe on you. Do you feel okay sitting? Are you balanced, dizzy, or anything?
Nope.
Okay, good. Put this robe on. Get this sheet out of the way, make sure it's covering you. Good. Okay. Take this out. I'm gonna go ahead and just put your seat belt on now. This is just to help me in case, or whenever we're moving over to the or to the wheelchair, so I can grab you if I need to. Okay, help you over. Gotta be a little nice and snug. Okay. Those shoes stand on for you? Okay, so now we're going to test your upper body strength, just a couple muscle testing. So we do it on this side. I'm going to have you put your arm out like this. Okay. And then I'm just going to have you hold it for 5 seconds. Okay. 5. And then you go back. 1, 2, 5 also. Come out to the side. 5. Bring it down to your side and don't let me pull you out. Okay. Good. 5 also. And we're going to do some medium lateral rotation, so don't let me push you out. Okay. 1, 2. Switch ways. Push out into my hand. Alright, that's all 5. Good job. And then I'm going to do some elbow muscle strength. Just going to have your hand like this. I'm going to push down. Don't let me push down. Good. And then I'm going to have you come out to the side like this. And go ahead and try pushing my hand. Good. Those are both 5s also. Okay, and then I'm going to have you turn your hand over like this and try to turn it that way, or like that, and I'm gonna hold you. Okay. 1, 2, 3, 4, 5. Good. And the other way. 1, 2, 3, 4, 5. Good. And then I'm gonna do have your hand up like that. I'm gonna try to push against you. Okay. Okay, and then flip over. Good. Those are all 5s. I'm gonna go ahead and squeeze both my fingers as hard as you can. Alright, those are both even. Good job. Okay, now I'm going to test your lower leg strength, and I'm going to have you kind of lift this up to my hand. I'm going to try to push you down, and don't let me push you down.
Okay.
Just sit up straight. Good. And then I'm going to have you kind of push into my hand.
Okay.
Okay, and then can you push out? Good. And then I'm going to have your leg go like this, and can you push? 2. Good. Now this way. Good. And then now I'm going to look at your knee. So go ahead and put your leg out a little less than straight, and go ahead and push against my hand. Good. And then bring it back this way, and don't let me pull you out. Good. And then I'm going to have you bring your leg out and point your toes up as far as you can. Don't let me push them down. Good. I'm going to have do your great toe. Just kind of point that up and don't let me push it down.
Okay.
Good. That all looks good. You got 5s everywhere. This hip flexors might be a little 4 plus.
Yeah.
Alright, and then we're going to do, I know this hurts over here, but we're going to try to see if you can lift your hip up the same way you did over there to my hand.
Okay.
If you can hold that. Okay, good. A little bit weaker than the other side, maybe a 4. And then go ahead and push out into my hand. Okay, and then push into my hand. Good. Those are both 5s. And then go ahead and point your toes up to the sky. And don't let me push it down. Good. And then your big toe. 3, 4, 5. Good. Those are both 5s as well. Okay, and now I'm going to do some range of motion again, because sometimes it changes whenever you're sitting up. So just see, I'm going to have you try to bend your knee as much as you can on this side. Right about there. Okay, so we're at about 45, and then I'm just going to try to push it a little bit more and tell me till it hurts.
Right there.
Okay. Okay, we made it to about 50. All right, and now I'm going to have you try to stretch out that leg as far as you can. Straighten that knee. Good. Alright, we made it down to 25, and then I'm going to try to straighten it just a little bit more.
Right there.
Right there, okay. Okay, and we got down to about 24. Okay, good. So now what we're going to do is we are going to move over to the wheelchair. Do you still feel okay sitting up? Do you feel balanced and everything?
That's
Okay. This one, go. Blocks on. Move these out of the way. Okay. And then, alright, so this is how we're going to do this. I'm gonna have you, remember this is, you can't put any weight on this foot. The doctor said that, I know you know that, but we just gotta make sure we don't put any weight on that.
Okay.
And then we're gonna put all your weight on the left side. I'm gonna help you by holding your gait belt. Kind of push up with your upper arms and then go ahead and grab back for these arm rests right there.
Okay.
So we're gonna do this on count of 3.
Okay.
1, 2, 3. Kind of pivot over there. Good. I'm gonna hold this up. I put it on the elevated leg rest.
Okay.
And put this one on there. That's on it. And then we're gonna keep that gait belt on because we're gonna go down to physical therapy and do some more stuff.
Okay.
So always are a little cold, so I'm gonna put this over you. Make sure it's not in the way. And here we go. Okay, good job.